Good afternoon, everyone, and welcome to Virtually Speaking, a Columbia Nursing webinar series. My name is Lauren Porsche, and I'm the Assistant Director for the new Center for Sexual and Gender Minority Health Research. This afternoon's program is called Columbia Nursing Takes the Lead in LGBTQ Health Research, and we'll learn all about the new center. We hope you find this program interesting and that you will come to future programs sponsored by the Office of Alumni Affairs and Development. Before we start, I just have a few housekeeping items. For those who submitted questions ahead of time, thank you. We will address these at the end of the program, time permitting. In addition, please note that everyone except our speakers is muted. If you have questions that come up during the talks, please utilize the chat feature at the bottom of your screen. And also thank you in advance for your understanding about any technical difficulties that may arise, although our intention is for everything to go smoothly. It is now my pleasure to introduce Dr. Walter Bochting, who is the co-director of the Center for Sexual and Gender Minority Health Research. Welcome, Walter.
Thank you so much, Lauren. In 2012, I'm going to give you some history. We launched a program for the study of LGBT health at Columbia University Medical Center. And that program is a cross-school initiative between Columbia Nursing and Psychiatry. And I was recruited then to Columbia to co-lead this effort. And our charge was to begin implementing a research agenda consistent with the recommendations of the Institute of Medicine report on the health of LGBT people. It was called Building a Foundation for Better Understanding. And both myself and our former dean, Bobby Berkowitz, served on the committee that put this report together. Since then, NIH has begun to refer to LGBT people as sexual and gender minorities. And this includes individuals who identify as intersex. NIH then declared sexual and gender minorities a health disparity population for NIH research, and that's what our new center focuses on. Our initial priority areas were and families, aging, and transgender health. And each of these three areas has grown with multiple faculty and funded projects in each. For example, in the youth and families area, we completed a study of gay fathers and their young children and developed an online peer support intervention for trans and gender non-binary adolescents. In the aging area, we are examining the social support networks of LGBT people, comparing those with the networks of their cisgender heterosexual counterparts, in order to determine the role of social connectedness in cognitive aging. And in the transgender health area, we are now in the 7th year of following a cohort of trans and non-binary people in New York City, San Francisco, and Atlanta. It's named Project Affirm. And non-binary people refers to people who identify their gender identity as different from simply boy or girl, man or woman, but rather as both, neither, gender fluid, or gender queer. So Project Affirm aims to understand their identity development, resilience, and our new project period has a focus on risk for cardiovascular disease. And then finally, we also just started a partnership with the Visiting Nurse Service of New York to understand the needs of transgender patients immediately following gender-affirming surgery and to examine the impact of this surgery on their quality of life. Now, in 2017, we added 2 new priority areas to our program. One was sexual minority women's health, and the other one was the neuroscience of gender. And as part of an LGBT scholars cluster hire, supported by the Columbia Provost Office, we recruited Tonda Hughes. And Tonda was recruited to specifically lead the sexual minority women's health area. She has followed a unique, large and diverse cohort of lesbian and bisexual women for over 20 years, and with a current focus on the impact of gay marriage and the relationship between alcohol use and intimate partner violence. Tonda has had a long-standing commitment to promoting LGBT health research in nursing, And it was her vision to create our new Center for Sexual and Gender Minority Health Research, which we launched earlier this year. So before I turn it over to Tonda, I want to thank our Dean, Fraser, and our Vice Dean of Research, Dr. Corwin, for their continued support of our work. Together, we established LGBT Health as one of the jewels in the Columbia Nursing Crown. So it's now my great pleasure to turn it over to Dr. Hughes, our Hendrik Bendiksen Professor of International Nursing, Associate Dean for Global Health, and our new Center Director. Tonda?
Thank you so much, Walter. Hello, everyone. I'm Tonda. My pronouns are she, her, and hers. And it's so wonderful to have all of you here today. We're really excited to tell you more about our new center. As Walter mentioned, I am the PI, well, I don't think he mentioned the study, but sexual minority women's health is my area. And I'm the PI of a 21-year longitudinal study of sexual minority women's health. And sexual minority women includes lesbian women, bisexual women, really any woman who identifies as something other than exclusively heterosexual. The study that I lead is called the Chicago Health and Life Experiences of Women Study, and we call it that. We also use CHLU for the short acronym. And you'll hear a number of our fellows talk about their work related to CHLU and using data from that data set. It's called Chicago Health and Life Experiences of Women Study because it was launched in Chicago when I was at the University of Illinois at Chicago. I have been doing this work for a really long time, probably as early as 1990 or 91. And as I've moved through my career, I've become increasingly aware and dismayed, I don't think is too strong of a word, at how relatively little the nursing profession and nurses attend to sexual and gender minority health. And this is especially in comparison with fields like medicine, psychology, and public health. So I believe that nurses can and should be leaders in this area. So I was recruited to Columbia in 2017, as Walter mentioned, and I was attracted to Columbia because of its strength in LGBT health and the opportunity to combine my passions in LGBT health, Q health, with global health. And when I was being recruited, Bobby Berkowitz, who was the dean before Lorraine Fraser, we talked about how we could help maybe spur the work in nursing by having a national nursing LGBT health summit. And shortly after I got to Columbia, within about a year, we held a planning meeting that was in March 2018. And at that meeting were deans from about 6 schools of nursing. And we decided, yes, we would have this summit. And we formed an advisory committee that included deans from NYU, Yale, Johns Hopkins, George Washington, and Rutgers University. And we held the first National Nursing LGBT Health Summit in November 2019, just before COVID hit. This summit was supported by the Macy's Foundation, by Marianne Liebert, which is the publishing company for a number of sexual and gender minority health journals, and by funds from the U.S. Health and Human Services Department. About 15 nursing schools, including Columbia and others, donated between $1,000 to $10,000 to help support this summit. It included about 80 participants from 28 different universities, as well as leaders of organizations, including the American Academy of Nursing, the American Association of Colleges of Nursing, the National Institute of Nursing Research, the National Organization of Nurse Practitioner Faculties, and others. And in that meeting, we took the first steps toward creating a national action plan to raise awareness and improve LGBT health. We have a white paper submitted to Nursing Outlook, and hopefully that will be published before too much longer. And in general, the summit was, I believe, a big success. Some of you may have seen the press release. If not, I think, Lauren, if you could put that into the chat, that would be great in case people do want to see it. So the new center, the Center for Sexual and Gender Minority Health Research, is one of the major outcomes of the summit. I think by attending the summit, Dean Fraser, it crystallized for her the importance of nursing taking the lead or being one of the leaders in sexual and gender minority health. So we're very pleased about the center. It has funding from Columbia Nursing, and we're also looking for other funding sources to support some of our initiatives. For example, and this is just one, I can tell you about more later in the question and answer session. We hope to hold an SGM research boot camp, maybe a week-long boot camp in residence for people who are interested, nurses to begin with, who are interested in doing research related to sexual and gender minority health. So keep an eye out for that. But you'll hear now from the Center Fellows, which is the most exciting part. They're an amazing group of students and new investigators whose work is addressing some of the key gaps in knowledge related to sexual and gender minority health. We at Columbia are really so proud of them. And one of the major bragging points about them is every one of them either has external funding for their research from NIH and other agencies, or have applied for that funding. So let's turn it over to them now and let them tell you about their exciting research and how they're working to solve some real world problems and to close the gap in terms of SGM health equity. So Lauren, if you would introduce our first speaker, that would be terrific.
Sure. Our first speaker is Kodiak Soled, a fourth-year PhD student who will speak about her research.
Hi, everyone. I'm Kodiak Soled, a PhD student in my fourth year, mentored by Dr. Walter Bachtin, an NIH predoctoral research fellow. My program of research broadly focuses on perinatal, that's pregnancy through postpartum, health and well-being among LGBTQ people. So we know legal rights, increased rights, legal protections, and medical advances have benefited many of the communities under the LGBTQ umbrella, and shifted many of our lived experiences from surviving to a place of thriving. And building a family as an LGBTQ person can be a really powerful experience that represents that thriving and a hope for a better future. And we're seeing that. We're in the middle of a massive baby boom among our community. A 2018 report showed new growth is expected among LGBTQ families as younger generations are having or considering having children at nearly double the rate of older generations, 77 versus 44%. And nearly 50% are actively or intending to grow their families right now. However, there's little research on the health and well-being of our community during this vulnerable time in the lifespan. What's worse? Healthcare providers will report insufficient preparation to provide quality care to us, and emerging evidence shows LGBTQ people may be at increased risk for poor perinatal mental health and birth outcomes, such as miscarriage, stillbirth, and very preterm birth. The good news is that we know social support, such as having someone to talk to about fears surrounding birth, or having someone watch your baby for a few hours so you can take a quick nap. Those things are a modifiable risk factor or something we can change that significantly reduces the risk of those specific outcomes. So my longitudinal study, funded by both the NIH and A1, explores social support experiences among LGBTQ childbearing people before and after the birth of the child. This work is contributing to a foundation of research that will explore and illuminate the unique needs, challenges, and strengths among our community, particularly for those who achieve parenthood through biological means. Documenting our stories is the first step towards improving the health and well-being of LGBTQ childbearing people and the future of our community. And that's the promising future I'm committed to and actively building towards. Thank you.
Thank you, Kodiak. Our next speaker will be Yashka Sharma, a second-year PhD student.
Thank you, Lauren. Hi, everyone. My name is Yashka Sharma, and I'm a second-year PhD student being mentored by Dr. Tanda Hughes and Dr. Billy Caceres. I am very passionate about understanding factors that influence cardiovascular health of sexual minority women, such as lesbian or bisexual women. Specifically, I want my work to focus on hypertension. We know that hypertension is a major public health concern, but did you know that hypertension affects nearly 116 million adults in the United States? Research shows that sexual minority women have a much higher risk of hypertension compared to heterosexual women. Sexual minority women are much more likely to smoke, drink alcohol, have diabetes, and sleep for shorter duration, all of which, as we know, contribute to higher risk of hypertension. So despite knowing that this major health disparity exists, there are still very few studies that are looking at why does this difference exist and what is the underlying reason. And that's where my research comes in. I recently submitted a pre-doctoral fellowship grant to American Heart Association, where I'm proposing to use Dr. Hughes's 21-year-long data set to examine the associations of family-level factors with hypertension in sexual minority women. The two factors that I'm focusing on are sexual identity disclosure and family support. So you might wonder why specifically these two factors? So a recent study showed that women who disclosed their sexual identity to more family members were less likely to die compared to women who did not disclose their sexual identity to family members. We also know that sexual minority adults who have more family support are less likely to have depression or anxiety. So literature shows that family factors are essential to the health of sexual minority women, which is why I chose to focus on these particular factors. And I really hope that my work will play an important role in reducing the cardiovascular health disparities that currently exist in this population. Thank you so much.
Thank you, Yashika. Our next speaker will be Sarah Zelweg, a third-year PhD student.
Hi, my name is Sarah Zelweg, and I'm mentored by Dr. Tanda Hughes. I'm studying alcohol use among lesbian and bisexual women. Excessive alcohol use stresses relationships, families, and communities, and puts people at higher risk for all kinds of poor health outcomes, such as depression and heart disease. Alcohol contributes to more than 95,000 American deaths annually, is the third leading cause of preventable death in the United States, and it costs us almost $250 billion each year. Lesbian and bisexual women in particular are at high risk for excessive alcohol use and negative outcomes related to alcohol use compared to heterosexual women. The main theory behind this disparity is minority stress, meaning exposure to stressors such as discrimination. Minority stress can operate at multiple levels, such as internalized negative feelings about being lesbian or bisexual, rejection from family members, or laws that discriminate against sexual and gender minority people. For example, think about a lesbian couple trying to adopt in a state that allows adoption agencies to discriminate against sexual and gender minorities. Not only are they likely to have difficulty finding an adoption agency, they're exposed to the stress that comes from living in a hostile social and political environment, and they may feel distress in anticipation of experiences of stigma or discrimination. To better understand the full picture of these multiple stressors, I'm using Dr. Hughes' groundbreaking longitudinal Chalou study to examine multiple levels of minority stressors and their relationships with alcohol use among lesbian and bisexual women. This will help inform prevention efforts and policies, screening strategies, and interventions to decrease excessive alcohol use and its consequences. By informing prevention and intervention strategies at multiple levels, we can more effectively move the needle on excessive alcohol use among lesbian and bisexual women. This field of research has really grown in the last 20 years, and I'm excited to be a part of the momentum and to move the field forward and work toward eliminating health disparities in lesbian and bisexual women. Thank you.
Thank you, Sarah. Our next speaker will be Dr. Lauren Boccicchio, a postdoctoral research scientist.
Thanks so much for the introduction. I'm Dr. Lauren Boccicchio, and I'm a postdoctoral research scientist at Columbia School of Nursing. I work with Dr. Tonda Hughes, and I study sexual minority women's health and alcohol use. Alcohol misuse is the 7th leading cause of death and disability worldwide. But the consequences of drinking are magnified for women as they're at greater risk of developing alcohol-related diseases, such as liver and heart disease, cognitive impairment, and some cancers compared to men. However, did you know that the risks associated with alcohol misuse vary even among women? In particular, sexual minority women consistently report higher rates of drinking and alcohol-related problems, such as divorce, financial, employment, and other health issues compared to heterosexual women. While minority-specific stressors, such as exposure to stigma and homophobic discrimination, have been identified as the leading risk factor for problematic alcohol use among sexual minority women, it doesn't fully explain the sexual orientation-related disparities in drinking. Therefore, it's essential to understand how other factors combine with minority stress to increase sexual minority women's risk of alcohol misuse and related problems. My research program broadly focuses on improving our understanding of the risk factors and underlying mechanisms for alcohol use among sexual minority women, specifically aiming to understand the associations among trauma-related stress, such as childhood sexual abuse, minority stress, stress management, and drinking among sexual minority women. Understanding these differences in risk is critical to the development of more targeted prevention and early intervention strategies to reduce drinking in this population. My study will examine these relationships using data from my mentor's 21-year longitudinal study of sexual minority women's health and alcohol use. I plan to submit this research proposal to the National Institute of Alcohol Abuse and Alcoholism this coming December.
Thank you, Lauren. Now we'll hear from April Ancheta, a 4th-year PhD student.
Hi, everyone. My name is April Ancheta, and I'm a PhD student here at the School of Nursing, mentored by Drs. Tonda Hughes and Jean-Marie Bruzzese. And I'm also an NIH predoctoral research fellow. And I'm really passionate about the protections of sexual and gender minority youth, or SGM youth, in schools. Did you know that SGM youth are 2 to 3 times more likely to attempt suicide and are more likely to report being bullied or harassed in schools compared to their heterosexual peers? My research here at the School of Nursing seeks to influence policy and practice to reduce this rate of harassment and other disparities faced by SGM youth. I would love to make it a reality where being bullied in schools is not an inevitable part of being a sexual or gender minority kid. Specifically, in my work, I examine the impacts of positive school climate for SGM youth, as well as the effects of anti-bullying policy that explicitly states protections on the basis of sexual orientation and gender identity. In general, bullying and harassment not only affect one's mental health, they could also negatively affect one's physical health. Prior research has shown that SGM youth have higher rates of overweight and obesity compared to their heterosexual peers, but what might be a contributor to this disparity? My work tries to address this question. Experiences of bullying and adverse childhood experiences have been linked to obesity due to chronic stress experienced. But what if we promote positive school climates, therefore decreasing rates of bullying for SGM youth? Could this also be associated with a decrease in overweight and obesity? The central idea behind what I research is that if we improve the school environments for SGM youth through positive school climate and also through state level anti-bullying policy, then these students will feel included, seen, and supported. And therefore, they can grow up to become healthy and secure adults. With COVID-19 now, we are realizing the importance of schools and the social and emotional environments they foster more than ever. And if homes or the places these students live are not a safe place for them, then schools can and should be. I look forward to being part of this next generation of sexual minority nurse researchers, contributing to this work to advance the health of SGM youth. Thank you.
Thank you, April. Our next speaker will be Joseph Balor, a 3rd-year PhD student.
Thank you, Lauren, for the introduction. I'm Joseph Balor, everyone. I'm a psychiatric nurse practitioner in third.
We can't hear you, Joseph. You're breaking up.
I think we can go on to the next speaker and then come back to Joseph. So in that case, I'm going to move on to Dr. Billy Caceres, an assistant professor, and we will come back to Joseph in a few moments. Dr. Caceres?
Hi, I'm here, sorry. So it's really a pleasure to speak about my research with all of you today. So my research measures behavioral and biological factors, so things like blood pressure and glucose, to understand and reduce heart disease risk in minority populations, with a particular focus on SGM adults and people of color. And this research is especially important because heart disease remains the #1 cause of death among adults worldwide, and actually more than 90% of heart disease diagnoses are considered preventable. So my research is informed by my clinical experience as a cardiac nurse, where I witnessed shocking differences in the care and supportive resources available to SGM patients following cardiac surgery. When I began my PhD in 2013, I quickly realized that heart disease was an important but understudied problem among SGM populations. And for instance, the National Academy of Medicine's 2011 report on the health of SGM people identified heart disease as a priority research area for SGM health. Over the past decade, we have come a long way in our understanding of why SGM adults have higher heart disease risks than the general population. We now know that higher exposure to discrimination and violence and higher rates of poverty all negatively affect the heart health of this population. And I am proud to say that my research has provided us with a greater understanding of disparities in high blood pressure, obesity, tobacco use, and sleep problems among SGM adults. And last year, I had the honor to lead the American Heart Association's first report on the heart health of SGM adults, but there's still a lot more work to be done. My current studies seek to not only better understand heart disease risk in SGM adults, but to also understand how to decrease it. For example, in one study, we are recruiting the heterosexual sisters of sexual minority women that are enrolled in the Chalou study, which you've heard a little bit about today. And we are seeking to understand how greater exposure to discrimination and violence may lead to increased heart disease risk among sexual minority women. In another study, we are collecting genetic data from SGM people of color to understand how discrimination may affect their heart disease risk at the cellular level by changing the actual function of their DNA. And finally, because of the great need for interventions to reduce heart disease risk among SGM adults, this summer, I began a study to understand the perspectives of sexual minority adults about strategies to reduce their heart disease risk. And all of these studies are really expected to inform interventions to promote the heart health of this population and hopefully extend their lives. I also, as an assistant professor here, I also have the great pleasure to work with and mentor graduate students from Columbia Nursing, our School of Public Health, and our medical school, who are all interested in heart disease risk among SGM adults. And I think with this new center, we will have even greater opportunities to mentor the next generation of researchers who will go on to make impactful and tangible contributions to improve the health of the SGM community.
Thank you, Dr. Caceres. We're now going to move on to Dr. Cindyvaldis, an associate research scientist and psychologist. And after Dr. Valdhuis, we'll see if Joe Belore is ready to speak.
Thank you, Lauren. Sexual minority women, and by that I mean women who identify as lesbian, bisexual, pansexual, basically anything other than strictly heterosexual, have much higher rates of depression, suicidal thoughts and behaviors, and other poor mental health outcomes compared to heterosexual women. And we know a bit about why that is. Sexual minority women experience far more stressors than heterosexual women due to marginalization of their sexual identities. Sexual minority women also face much higher rates of violence and victimization. But these factors don't fully explain these disparities. And given sexual minority women's exceptionally high risks for poor mental health, we pretty urgently need to figure out what actually does explain these disparities. Interestingly, one of the biggest influences on heterosexual women's health is their relationships. Relationships can play a protective role in health, but they can also increase risks, especially in relationships where there's a lot of stress. Unfortunately, there's very little research on the role of relationships in sexual minority women's health, but I would argue that relationships play an important and woefully under-researched role. As a doctoral student, I read the literature on sexual minority women's drinking, and I noticed a ton of research on heterosexual women's relationships and alcohol use, but there's only one paper on relationships and drinking specifically among sexual minority women. And that study focused solely on young white women. And that made up the entirety of what we knew about relationship influences on sexual minority women's drinking at that time. Research on relationships and other health outcomes was not much better. So I decided to make that my life's mission, to understand the role of sexual minority women's relationships on their health. I used data from Dr. Tonda Hughes' longitudinal study of sexual minority women's health that included a highly diverse sample of women, and I found that relationships are a potent predictor of health outcomes for sexual minority women. But all of my quantitative data is focused on individual experiences. To truly understand the associations between relationships and health, we need data from both partners to understand both perspectives. But in general, using dyadic data is pretty rare, although it's increasing. But as I noted earlier, data on couple relationships among sexual minority women is excruciatingly sparse. And it probably won't come as a surprise to anyone that dyadic research, and that's research that includes both partners, is even more sparse. My research is unique in that regard because I'm conducting qualitative interviews with couples, both together and separately, to understand both partners' influences on their well-being. And because I'm a psychologist, I want to understand the whys and the hows. So my research is also focused on mechanisms. What exactly is going on in these relationships that might impact their health? Okay, so why is this important? Ample data shows that couple relationships are an important context for health and for mental health interventions. By understanding which stressors have the keenest effects on relationship functioning and what factors within relationships may increase or decrease health risks, we'll be able to create novel and effective interventions for couples that will improve mental health and achieve health equity for sexual minority women. Thank you.
Thank you, Dr. Veldhuis. So I'd just like to see if Joe Belore is back on and able to speak.
Yeah, it should work. This is, sorry, the first time my high-speed internet is unreliable. So I apologize. I'm going to turn my camera off just so I'm not interrupted, hopefully. All right.
Okay, thank you.
Okay. So hi, everyone. I apologize earlier. I'm Joseph Balor, psychiatric mental health nurse practitioner and third-year PhD student at Columbia University School of Nursing. My research interests include mental health and health disparities in sexual and gender minorities. I'm mentored by Dr. Bogdan, and I'm currently working with Project Affirm, which is the ongoing multi-site cohort study of transgender identity development across the lifespan. And it's really to understand the relationship between adverse life experiences and sleep problems in transgender and non-binary adults in my research. So you might be surprised to know that sleep health is actually an under-recognized public health concern in the United States today, one that is strongly associated with morbidity and mortality. In fact, sleep health in sexual and gender minority adults is an emerging health disparity. Trans and non-binary adults may even be at particular high risk of sleep problems, including short sleep duration and poor sleep quality. Yet little is known about the factors that influence sleep health in this population. Furthermore, trans and non-binary adults experience disproportionate rates of adverse childhood experiences and discrimination, which may negatively affect their sleep health. Preliminary data from Project Affirm indicate that higher levels of discrimination are indeed associated with lower odds of adequate sleep duration. My work will determine differences in sleep patterns among trans and non-binary adults using a tigraphy, which is kind of like a Fitbit, a validated non-invasive method, which really objectively measures sleep parameters, such as like total sleep time and sleep efficacy. And this will be over 14 consecutive days. And this will hopefully help determine whether these findings support the need to develop personalized sleep health interventions tailored to their unique experiences. It will also address knowledge gaps in our understanding of how adverse childhood experiences and discrimination might contribute to poor sleep health in trans and non-binary adults. This study is aligned with Healthy People 2030's goal to improve the health, safety, and well-being of lesbian, gay, bisexual, and transgender people. It will facilitate a deeper understanding of transgender and non-binary health disparities and advance personalized health interventions tailored to improve sleep in trans, non-binary, and other stigmatized adults, which ultimately can lessen the effects of disproportionate chronic, mental, and physical health problems observed in these populations. Thank you.
Thank you, Joe. So now I'd like to open it up for questions or comments. If you'd like to ask a question, you can feel free to unmute yourself and ask, or you can put it in the chat. And we do have a few pre-submitted questions, so I'm just going to start asking those in order. Okay, so the first question that we have is, this one is for Lauren Boccicchio. What do you envision as next steps in your research once mechanisms such as childhood abuse, underlying hazardous drinking, and sexual minority women are discovered?
Thank you. So I would say that the next steps are really to begin to establish interventions that actually better meet the needs of sexual minority women. And so as we know that interventions have been previously adopted, such as cognitive behavioral interventions and other forms of kind of transdiagnostic interventions to better meet the needs of LGBTQ individuals. And those interventions typically incorporate aspects of minority stress theory to really incorporate ways to challenge internalized homophobia, different things that come up because we live in this world that is very much oriented towards heteronormativity. And so for kind of next steps, it would be the development of those interventions and then actually testing those interventions to see if they're more effective than treatment as usual.
Thank you. The next question is for Dr. Hughes. What are your hopes and goals for the center in 5 years and 10 years? Or what is your long-term vision and where would you like to see the center go?
That's a big question. Geez, my long-term vision is that nurses and the nursing profession really is a leader in this area. As I said earlier, I don't really understand the reasons why nurses have been reluctant to take the lead, because we are, we're the largest profession, healthcare profession in the world. We interact most closely with clients, patients, people who need healthcare. And so we really are the profession, the people who need to be leading in this area. So we're hoping that the center can be one way to both increase visibility and to increase research in this area. We've applied for an institutional training grant that would allow us to fund and train both predoctoral and postdoctoral students, fellows in this area. And so that's a big goal. As I mentioned, we hope to have regular educational opportunities, things like the boot camp, seminars, more webinars similar to this one. So, we're open though, if you have suggestions about things that we might do to help move the profession along, to help nudge them, I'd really be open to hearing those. So thank you all again so much for being here. It's really exciting to hear from our folks and to see all of you here. So thank you.
Thank you. The next question is probably best answered by Tanda and Walter. Other folks might want to chime in as well. And the question is, with the unfortunate cancellation or postponement of Columbia's Trans Health Gender Non-Binary NP certification program, will there be some type of collaboration between the center and this effort to promulgate clinicians' education in this area?
I think I can answer that. I actually just had a meeting with Laura Kelly, who is the leader in this effort, and we're not canceling it. We are indeed delaying its implementation. and we are very committed. We have done smaller training events throughout the years of our program, and we'll continue to do that at CUMC. But this training program really has a national scope to be able to train nurse practitioners to provide gender-affirming care and develop their competencies in that regard. Casey, I know that you are one of the instructors in this new program, so perhaps you can say a few words as well.
I'm actually not one of the instructors, unfortunately. That would have been nice. I did help to design the syllabus of one of the courses though, but the way my current position is configured, it wasn't possible for me to actually teach that course, at least up until now. Maybe things will change. But yes, we're not canceling it, just postponing the implementation and looking forward to that going ahead.
Thank you. The next question is for Dr. Caceres and or April. And the question is, I understand that Columbia is leading a new mentoring program for pre-licensure nursing students. Can you tell us more about that program?
April, you can go ahead.
Sure. So Dr. Caceres and I have pretty much started a new program in partnership with the National Student Nurses Association, or NSNA, which is the largest pre-licensure nursing student association across the country. And it really grew out of the summit that Dr. Hughes has spoken about that was held in November of 2019. The real goal of this program is a mentorship, so pretty much connecting all these pre-licensure students that are enrolled in not only bachelor's degree programs, but also associate's degree programs, because we know that there are education disparities in what you're able to get access to. So we really wanted to, I guess, like hone in and like obviously really appreciate the different entry to degree programs that are in existence. But pretty much we opened up this application to all NSNA members across the country to be partnered with experts across the field in LGBT health and nursing that run the gamut from adolescent and youth health, but also geriatric expertise and across the board. So we're really excited that we just launched the program this past summer. We have a total of 6 mentee-mentor partnerships, and we're holding bi-monthly meetings, and it's actively going on. So we're really excited to see where this goes. But Dr. Caceres, you could definitely add on.
No, I think you covered all the main components. So the mentees who are pre-licensure nursing students are all assigned a doctorally prepared nurse with expertise in LGBTQ health. So we have both DNP and PhD prepared faculty, and they meet with their mentors on a monthly basis. And the outcome of the program, in addition to sort of increasing their knowledge about LGBTQ health, is also they are expected to work on a final project articulating either clinical or research or policy implications relevant to nursing on a particular topic, healthcare topic. So the topics are a wide range of topics. They're all really interesting. And I think that April and I are also learning a lot from meeting with the mentees and learning about their areas of interest. So I don't know, we'll have probably more updates about the program sometime next summer when the program's over.
Thank you. The next question is for Sarah Zelweg, and the question is, which level of minority stress, so individual, interpersonal, or structural, do you think is most important to your outcomes, and which ones would be the easiest to intervene on?
Thanks, Lauren. That's a really good question. That's really a big part of what I'm trying to do with my research, is I'm trying to kind of tease out those relationships and see which pieces might be more important than others, and how they might work together to increase drinking in sexual minority women. And I think for me, really, I keep coming back to the policy piece, because the policy not only affects a large group of people all at the same time across the board, but it also really affects the social environment as well. I think if we look back at the legalization of marriage, we have a lot of studies that have shown that it really improved sexual minority women's well-being. And so I think that if we continue improving policies like that and improving the socio-political environment, I think that we can really make a difference. And And we know that that affects people on the individual and interpersonal levels as well. And so I think that policy is where I keep coming back to. I don't know that it's the easiest necessarily, but I think that there are certainly concrete steps that we can take to change and improve policies. So I think it's a good place to focus.
Great, thank you. So the next question is from one of our audience members today who is asking about dissemination plans for research. So this question is really for any of the speakers. She says, thank you for all of your present and future studies. They're very impressive and well thought out studies. My question is, how will your findings inform the practice of nursing? Have you built in any type of dissemination for nurses into your research plans?
Who was that? Who was that for, Lauren?
Oh, it was really for anyone.
Well, I was typing a question myself, so I didn't hear it. Sorry.
Okay, so the question was, how will your findings inform the practice of nursing, and what are dissemination plans exist for getting the findings out to nurses in the field?
Well, this event was one such attempt to do that. We specifically invited our alumni and others related, nurses from various areas, who are associated with Columbia in some way or associated with one of us. We do a lot of presentations. I'm speaking at the American Academy of Nursing tomorrow or Thursday about this very topic, not our center, but about nursing's the need for nursing to move forward, to be leaders in this area. But I'm sure anybody on this panel or any of us could also address that. I think we're doing in many ways.
I would say that we're also translating our findings really in training, in various training programs for the professions, and we communicate our findings to the public as well through our websites and our social media presence.
As well as with the assistance of our communications department, who put out press releases to the mainstream press when we have new publications or events.
One of the other ways too is, and Tonda and I are speaking next month at the New York Presbyterian Clinical Nurses Summit. So it's also going to clinical settings and clinical meetings to also highlight some of the work that we're doing. And I think that we tend to present at research focused meetings, but I think whenever we can to sort of reach out to clinicians, I think is also really important to get the work out there. And I know that several of us have existing community advisory boards as part of all of our studies. And one of the things that we do is, at least in some of the community advisory boards for my studies, is that we have clinical nurses on those boards as well to think about how we can disseminate or implement the findings of those studies into clinical practice. So I think there's a number of different ways, but I certainly think that it's one of the conversations we've had as faculty of the center of really maximizing and making clear how our findings are going to be disseminated and implemented to clinical communities. So I think that's an excellent question.
Thank you. We had another pre-submitted question. I think this is for anyone. How do you see nursing research filling a gap in the current landscape of SGM research?
Well, I can just say that when we did the review of what we know about LGBT health, that there was more gap than research at the time. So I think we've been trying to fill these gaps. And for example, one area that we are expanding into is aging, because we have a very growing LGBT population that is aging, and yet is very little research and knowledge how to best serve them. So that's why our training program that we're planning is designed to recruit investigators interested in that area, students interested in that area, to fill those gaps.
Just to elaborate on that a little bit, Casey Jackman actually led a review of the literature that built on Nikki Eliason's earlier work, looking at what the top nursing journals are publishing regarding sexual and gender minority health. And unfortunately, it's not a lot. Casey, I don't know if you want to say something more about that, but I think I also saw that Mickey Eliason is on.
Yeah, Mickey's on the call too. Yeah. Yeah, so Mickey and colleagues did that original review of some of the nursing literature. I think it was 2010. So we did sort of a follow-up of that paper back in 2017, 18, looking at the top nursing journals by impact factor, what percentage was reporting on LGBT health topics, and found it increased a very small amount. I think it was like 0.19% in our review, something like that. So, but there was evidence of increasing interest. So we were looking specifically at empirical research articles, but we did find several editorials or theoretical articles that we didn't include in our review because we were focused on one type of article. So there's evidence that there is increasing interest, which I think is also demonstrated by the attendance at this event today, but the research is just not quite caught up yet.
And that article actually won an award. It was Nursing Outlook's best research paper for, was it last year or this year?
I think it was last year.
So, Casey, maybe you could put a link or something in the chat.
Yeah, I'll do that. Absolutely.
Thank you.
Great, thank you. The next question is for Kodiak. Kodiak, can you say more about how your research relates to trans and non-binary people who are part of the lesbian, gay, bisexual, and queer community?
Definitely. So my study, the study of queer and trans perinatal resilience and experiences of gestation, otherwise known as queer and trans preg, it's actually the majority involves trans and non-binary participants. And so we're getting a really robust understanding of what their childbearing and social support experiences look like too. And on more of a broad scale, I think it's really important that we're including trans and non-binary folks in who we think about in sexual and reproductive health and other perinatal areas, as they're getting certainly left behind, even more so than sexual minority women. A lot of big databases have started to include sexual minority women in them. And so we're starting to see emerging data and to be able to see bigger trends among our community. But all of the, unfortunately, we haven't included gender minority data collection tools in those data sets. And so we still have no idea kind of what's going on for that population. And so I think it's really important, especially in the literature, we see that nurses in particular have created the most harm for childbearing people during across the pregnancy and postpartum continuum. And so I actually will be presenting to A1, which is an association of obstetrics and neonatal nurses next week, to be able to disseminate my findings there. And as well as just kind of being in the community and giving other lectures, I've been invited to like OB grand rounds to present there too. And so I think those are really important areas to affect nursing, but also of the continuum of colleagues that perpetuate harm or have the potential to influence for the better experiences during this really vulnerable time.
Thank you. So we have a comment. As part of dissemination, I could suggest that you all consider, in addition to the main articles on your data, consider publishing clinical applications articles in nursing journals to increase SGM content in those venues that are widely read by practicing nurses. And then we had some additional pre-submitted questions. This one is for Dr. Veltheis. Can you talk a bit more about how couples influence each other's health?
Sure. There are a number of ways that couples can tend to influence each other's health. One is that they can monitor each other's health and sort of course correct if one person's health gets off base, if they're not engaging in healthy behaviors. If for some reason they get sick and they need health care, the other person may push them to get health care. Another way is that they can sort of set norms within the relationship of what health is going to look like that they work out a certain amount each week, that they do certain things to take care of their health through their eating, things like that. And then another is that just by virtue of couples navigating adult transitions, like forming a relationship, formalizing the relationship, moving in together, that's not necessarily linear. Often the formalizing comes before moving in, but those kind of transitions, having children, things like that, that tends to increase people's desires to want to be healthier because they want to take care of themselves, their children. They want to make sure that they live for their families. And it also, having a partner, having kids can tend to make people feel like they have greater meaning in their life, and then they want to be healthier for that.
Thank you. I think we have time for about one more question. I don't see any new ones in the chat, so we do have one more pre-submitted question. This one is for Joe, and can you say a little bit more about why sleep is important, especially for SGM people?
Sure, I can do that. I'll keep my camera off just so hopefully there's no disturbances. But yeah, so there's been a growing body of research that has shown that gender and sexual minorities experience substantial health disparities, including worse mental and physical health compared to non-SGM people. And preliminary data from Project Affirm, I didn't share this before, but there's been about 45%, only 45% that meet criteria for recommended sleep duration, which is considered 4 to 9 hours per night, according to like top sleep associations like American Sleep Association, American Academy of Sleep Medicine. And then for sleep quality, their average is like around 2.5 out of 4, which is considered, fair. So, and there's this meta-analysis that, which is evidence that basically just combines a lot of results of multiple scientific studies over the years that actually has indicated that short sleep duration and poor sleep quality, which I sort of mentioned is seen in preliminary data in this Project Affirm, are indeed associated with increased cardiovascular disease, diabetes, obesity, and all-cause mortality. So with all that given, I think it's very important to look at sleep disparities in this population, considering that they do have more mental and physical health issues. So sleep could be a big link with these disparities that we're observing in this population. So I think it's really important to study.
Great, thank you so much. So I think it's time to wrap up. I want to thank everyone for joining us this afternoon, for hearing about our research and for getting involved in the center. I invite you to check out the center's website. I'm going to put the link in the chat so you can learn about upcoming events and what we're up to. And we do hope that you'll join us again at a future event. Thank you so much.
Thanks, everyone.